All right, thank you. Do we have Christine or someone from Communications Monitoring public comment? Let's see, Christine. Do we have any public comment, Christine?
Can you hear me now?
I can.
Yay. I just wanted to say that we do not have any public comment as yet, but I would like to remind anyone who's joined us that we have a link on our website if they want to submit public comment for a second opportunity, or they can also type it in the chat when you ask for the second public comment.
Great, thank you. All right, so moving on to our first agenda item is a welcome to our newest board member, Miss Christina Root. Oh, Jonathan, I'm sorry. I thought I was supposed to do that. I'm going to hand it over to Jonathan.
All right, thank you. First of all, I want to say I'm glad we will now be back up to full fighting force with a full board. So Christina Root, please feel welcome to our board, rounding us out. I appreciate it. And if you'd like to take a couple of minutes and provide a brief introduction, that would be awesome. Thank you.
Thank you so much. Hello, everyone. It's so nice to meet you all. I am really grateful and humbled to have this opportunity to serve as an OCHN board member with you. I am a proud alumna of Oakland University in Wayne State, where I studied social work. So I now have a master's degree, I have a limited license to practice, and I also have a certificate in human services management. I'm really passionate about helping and empowering others at the community level, so this position is so exciting for me. And in the past, I've gained experience working with the city of Clawson, working with the mayor for Rochester Hills, and also working with a state representative for the Grosse Pointe area. I also have about 3 years of experience as a service coordinator in the city of Detroit. I worked in an apartment building for 200 senior citizens and adults with disabilities, so I connected them to resources such as mental health services, doctors. I also hosted educational presentations and social parties. So that was a great experience. And then at the end of this month, I will be starting a new role as a remote crisis counselor. So I'm really looking forward to that. And in my personal life, I am a Christian, and I have experience volunteering in the church for our children with disabilities. And I also have a personal goal right now to become fluent in Spanish, so that way I can reach more people as a social worker in the future. So please let me know if you have any questions. Thank you for welcoming me to the board. I'm so excited to participate and serve the community with you.
Well, Christina, welcome aboard, as I said. Glad to learn a little bit more about you. I know over the next weeks and months, we'll get to know you very well.
Yes.
So again, welcome.
Thank you.
Back to you, Sarah.
Thank you, and welcome, Christina. All right, next on our agenda is a financial update with Anya. Are you here, Anya?
Looks like she's on, but
yeah.
And she's unmuted.
Now, can you hear me?
We can now.
yes.
Yes.
Apparently my headphones are not working. Just want to give you a brief update related to fiscal year 21. I apologize if it's a little noisy without my headphones. We have received our first capitation payment for fiscal year 21. We got that late in the month of October, so we're now using that information to basically redo projections for fiscal year 21, and then we'll be reviewing that information, and that is what will go into Budget Amendment 1, which I hope to do in December. So we have an updated outlook on fiscal year 21 related to revenue. In addition to that, we'll be incorporating the first quarter of the direct care wage increase that was approved but not included in the budget for the $2 enhancement. So with that, you should be expecting an updated conversation about that budget amendment probably next month in December. I just realized it is actually November already. So we'll be talking about that next month prior to the amendment being put for your approval. Does anybody have any questions?
I'm not seeing any. I don't.
Okay, thank you.
All right. Well, thank you. We are now moving on to Diana for our third agenda item, where we are going to be talking about Open Meeting Act's update. Diana.
Hello, good evening, everyone. So as most people know, the governor signed an amendment to the Open Meetings Act in the beginning of October. And what had happened was we were able to move to virtual meetings because she was able to issue an executive order that allowed us to be able to hold virtual meetings and be in compliance with the Open Meetings Act. When she was no longer able to, or those orders were found to be unconstitutional, then and outside of her powers, we lost that ability, which is why the legislature put through a new bill. So the first one, do we have the PowerPoint? Sorry, thank you. So until the end of the year, we can hold a virtual meeting until any reason, and then we can hold virtual meetings under specific circumstances in 2021. Everything expires for virtual meetings at the end of 2021. So we will have to revert back to in-person meetings, except for military members, unless there are additional changes to the Open Meetings Act. The great news is that this amendment made all actions that were approved by a public board to still be approved retroactively until March 18th. So all of our meetings that we've been having over the last several months where the board made approvals, those are still valid approvals, and we don't have to go back and take any more action on those. Next slide,
Are you taking questions along the way or at the end? What would be best?
I can do either.
You know what? I'll let you do this slide, and then maybe we'll see if there's any questions.
Okay, great. All right, so for the 2021 remote meeting criteria, you either have to be on military duty, have a medical condition, so injury, disability, or other health-related condition, or the state or local state of emergency or state of disaster has been declared. That can be at the state level, the county level, or at the city level. Next slide. So for 2021, in the amendment, the legislator put certain requirements that had to be met. Some of these are carryovers from the requirements that we had from Governor Whitmer's executive order. So one of them is you must be able to permit two-way communication between the public and the board, which we are able to do through Teams. A notice must be posted on our website at least 18 hours in advance of the meeting, which we do. And this is a new one, is that we're going to have to add a statement of why the public body is meeting electronically. We also need to identify how members of the public may participate in the electronic meeting, which we do. And the agenda must be posted at least 2 hours before the meeting begins. So those are all things that we have already been doing. Next slide. Each board member must publicly announce their remote location, including the county, city, township, or village where they are at, and the state. So this would be effective January 2021, if we are to have any virtual meetings. Military members who are remotely attending are excluded from all of these requirements. Finally, the location must be included in the meeting minutes. Next slide. So for our next steps, what we are doing is we have been in communication and will continue to be in communication with the Oakland County Board of Commissioners to understand how they are going to be handling meetings in the future after December 31st. And our goal is to stay in line with them. We are also continuing to monitor any pandemic orders issued by MDHHS due to capacity limits and other things that could also have an impact with us being able to have in-person meetings. Are there any questions?
Diana, it's Sarah. I don't see any other hands up, so I'm going to go ahead and just ask my question. So if, am I understanding correctly, so in January, meetings would have to resort to in person, but if someone does have a medical condition, they are exempted and could log in remotely as we've been doing right now. Is that?
That is correct. Yep.
Okay.
Absolutely.
So would the room be socially distanced then, our boardroom, or what plans are in place for that? And then I see two hands up that can go next.
Yeah, so that's a great question. We had presented, I think it was in July maybe, a proposed plan for the board with the room layout where everybody is at a distance of 6 feet apart. We also have the ability for the board to be able to hear the public to be able to hear the board, to ensure that we're in communication with all of those requirements.
Okay, I do remember that. Okay, do you want me
to? It seems like a really long time ago, right, Sarah?
Yes. Do you want me to call on the hands up, or do you want to? I see we've got, I know I saw Jonathan's hand, and I think Remy was first, and then Jonathan. But so Remy, if you want to ask your question.
Yeah. Do you know, Diana, if health-related conditions includes like maternity?
It actually doesn't just determine what a health condition is or give specific examples. So I think at that point, from a maternity, aspect, that, and for everybody, that you're able to say what your health condition is, or just say I have a health condition and I'm going to participate remotely.
Okay, I appreciate it. Thank you.
You're welcome.
Name.
Jonathan?
Yeah, that's what I understood. The premise behind health condition is you don't have to state what it is, just that you have one. You still, because you're remote, will have to identify where you are physically.
That is correct.
I don't remember if it was down to the city or township in addition to the county.
So it is the county, the city, and the state. So I would have to say for me right now, I'm in Oakland County, Michigan, in the city of Royal Oak.
And I'm West Bloomfield, but it doesn't enact until the 1st of the year.
That is until the 1st. That is correct. And then, back to, we're going to continue to see if there is a change at the Board of Commissioner levels. And the other thing is that if we had either the city of Troy or Oakland County declare a state of emergency, we would be able to continue with virtual meetings. So I don't know if that's something that the county is talking about doing or not.
Right, but either way, if we go down this path, and we do have meetings in our building, I would, if you are going to be someone who's going to use the medical or any other reason for remaining distant, let us know ahead of time so that we can make sure we don't set up enough seats all the way around the room if we don't need to. That's would be my recommendation to everyone. Make it easier on our staff. Thank you.
We appreciate that. Thank you. Dr. Hans? Dr. Hans, you are muted still.
Yeah, my question is about its health condition. So what about people who are at higher risk group, for example, elderly people, and there may be, I am one of them, age related at a higher risk. So is there any clarification on that, or what does the Oakland County Health Department has to say about that?
So back to, and Jonathan also said this, there is no definition for health condition. So you would be able to say, you know, I have whatever it may be, and you don't even have to disclose it, just say, I'm not going to participate due to, you know, health conditions or concerns. Like, we don't have to track that, we don't have to ask about that, but you do have to state that you have a health condition.
Thank you.
You're welcome. Are the restrictions, this is a question from Judy, are the restrictions on where we can be if we need to attend remotely? There are not any restrictions in the amendment. It would just be, once again, if I decided to, which I wish I could do this, go hang out in the winter in the Bahamas, I would have to state that I was joining the meeting from the Bahamas. Or Florida, or wherever it may be.
Diane, I have one more question for you. So if the building were not to reopen to staff, and I don't know what this, I know it was through the end of the year, if I remember from Dana's last correspondence. So if the building remained closed, would that have any impact on it, or we would still come together for meetings for those that could come?
The building really doesn't impact it. That's a really great question, because it is with the Open Meetings Act. Now, one of the things that we could do is, you know, and we have talked to our lawyers, you know, the board could also make the decision, and we can make the decision, and just to say, you know what, we're going to stay virtual. And if anybody makes a, you know, a claim that we're not following the Open Meetings Act, that we're willing to take that risk, and just say the only part that we wouldn't be in compliance with would be, you know, not being physically in the building. Outside of that, we're in compliance with everything else, from the two-way communication, the way that we've been posting our agendas, and all of those things.
Thank you. Yeah, I think all of us just want to make sure everyone remains safe and healthy, and we're doing the best for the individuals we serve, and staff and board members. So thank you.
Well, and that's exactly what, you know, we all say too, is that it's the board, the people we serve, you know, and most certainly all of us, you know, are concerned for our own health as well.
Thank you. So before we move on, any other questions for Diana?
All right. Thank you, everyone.
All right. Thank you, Diana. I appreciate that. All right. We are now moving on to the Relias contract presented by Dr. Lawson.
Hi, good evening, everybody. I'm presenting tonight to review the contract that OCHN has with Relias Learning for population health management. I'm going to be seeking board approval next week for a 1-year extension on the current contract at the full board meeting. So you did receive in your packet both the cover letter with a general write-up, as well as the initial contract that we entered into, and the pricing that contains the amendment. So I just wanted to give a little bit of background tonight. OCHN's used grant funding since 2015 to invest in and implement our population health management software. And as noted in the cover letter on your packet, this software has been really instrumental for us, particularly in our ability to integrate healthcare services for the people that we support, as well as for our NCQA accreditation. One important note that I wanted to make too is that we have 2 versions of this tool. One is for all of our behavioral health data, and a separate one for our SUD data. And we had to do this because due to the Code of Federal federal regulations or CFR 42, we can't mix our detailed SUD data with any other type of data without written consents and releases. And we didn't want to leave the people that we support who are served in our SUD network out of any of our integrated healthcare efforts. So we chose to fund the second version using our SUD funds. And so in your packet, you'll see the costs, which are broken out by fund source. And then this contract was negotiated in 2018 under our old process of having contracts included under the overall budget for board approval. So that's why this is, you haven't seen it before and it's coming to you now. Anya would have covered our current year costs with you when she reviewed the budget by line item during the study session in June. So this tool, the behavioral health tool, would have fallen under our grants line item, and then the other version would have fallen under our SUD funding lines. So as we pay for the one version using grant funds, the last grant round they approved us for all of FY21 as well as FY22. And so we're seeking approval from the board to extend this contract by 1 year to align with our funding stream. So with that, I will just pause and see if anybody has any questions. You could hear me, right?
Yes.
Oh, good. I
Jonathan.
panicked for a second. I thought I was talking and no one could hear.
Assuming there are no other questions, I have one for you. Why are we looking at only a 1-year extension instead of a few years? Are we thinking about changing to a different product once we've updated our strategic plan?
We are looking at that as a distinct possibility, yes. When we first started off with this project, there were not other items on the market that used HEDIS measures. And in addition, for ongoing NCQA accreditation, NCQA has kind of upped the requirements in that it has to be a certified tool from NCQA, and Relias is seeking that, and they do expect to get that in FY22. But that will be the fiscal year where we examine, are there other products on the market that might be more cost effective for us? And should, for any reason, this product not become accredited or certified by NCQA, we would have to find something different for our ongoing accreditation.
Thank you. I sort of read something about that. That's why I thought I'd ask.
Yeah, great question.
I have a question. This is Hadass. I don't know if you can hear me.
I can. Hi, Hadass.
Hi. Thank you for your presentation. So the grant fund, who is the grant fund from? What particular source?
So it is from MDHHS, from Behavioral Health and Developmental Disability Administration. And the grant funds, the department comes out with them. They've gone year to year. They've been approved for 2 years. 1 year we got approved for 3 years. And the department really dictates what is and is not an allowable cost under that grant. And so we've been really thankful that for the past several years, it's supported these efforts for integrated care. And that is one of the things that the department says those grant funds have to be used for, is for integrated healthcare.
Great, thank you.
Yep.
Well, thank you, Dr. Lawson. We appreciate the information. I'm not seeing any other questions.
Okay, thank you.
So thank you. All right, and we are now moving along to Jonathan to discuss standing committee assignments.
Thank you. So last week, a week or so ago when we had our last board meeting, we went through our process for officers, but we also looked at the opportunity to change where you could serve on one of our 2 standing committees. So our 2 standing committees are the Business Operations Committee and also our Policy Management Committee. Now today, both of those committees meet combined in our Committee of the Whole meeting, which is what this meeting is today. But the committees do have an opportunity when they have to drill down into something whether that's in-depth review of a policy or in-depth on financials, to meet separately. There is accommodation under the current rules for that. So it is important to identify which committee you would prefer to be a part of, even though you can attend both and you can attend and participate in any of these. At the last meeting, we identified the chair for business operations, Eric Lindemeyer, and Melchiah Newman as vice chair. Judy and Adam also identified that they wished to be on the business operations committee. So there's one more slot left to be on there. As well, we have the policy management committee, and Sarah was selected by her committee to be the chair, and Rena to be the vice chair there. And Dr. Taub also had expressed desire to be on that committee. So we have 3 slots remaining there. So what I wanted to do at this, I don't know if my microphone is working.
We can hear you, Jonathan.
Okay, because I just heard a change in noise. All right, so at this point, what I wanted to do is find out from the remaining members of our board what their preferences might be for policy committee or business ops.
And I think you might have 2 questions. I saw Bajaya's hand go up, and then John Paul's.
Okay, thank you. And
Yeah.
So Bajaya, please.
Yeah, I was at the last meeting and I had opted for policy. So I don't know why my name didn't come up on that.
Okay, thank you. We'll make sure that it's updated that you are on policy. All right. Does that answer your question, Bajaya?
Yes, thank you.
You're welcome. John Paul.
Thank you. I didn't have an opportunity to come to the last meeting, but I did want to be on business operations. That has been my preference. And I did speak with Eric Lindmeyer. I would like to be chair of business operations, and he has agreed to defer to that to allow me to do that if this body would be inclined.
Well, actually, that would be up to the Business Operations Committee, because they are, as a committee, select who their chair is and who their vice chair is.
Okay.
So
I would like to be on Business Operations Committee then.
At least to that extent, we can put you on that committee.
Thank you.
And based on our bylaws, you may not be able to succeed him until perhaps next year, unless Melchiah Newman chooses to have that happen as well. Okay. Unfortunately, we don't have accommodations for horse trading, if you will. So anyhow, so John Paul, you're going to be on the Business Operations Committee. Okay.
Yep.
All right. So that remains with 2 last positions. Hadass, I guess at this point, unless someone else wants to step off of business ops, you'll probably be on our policy management committee. Is that okay?
Hi, can you hear me?
Now we can, yes.
Oh, yeah. No, actually, I wanted to be on policy, so that's great.
Okay. And then our newest member to the board. So Christina, you are now also on the Policy Management Committee.
That's great. Thank you.
You're welcome. And as you saw, tonight was a committee of the whole meeting, and we cover all of the topics on both sides of the house, if you will. All right. So what's left now is really three other roles, which is the Recipient Rights Advisory Committee, the Citizens Advisory Committee, and the Oversight Policy Board Committee. Now, I've been on the Recipient Rights Advisory Committee for a number of years, and with my now being the board chair, I don't know if I'm going to have the availability to attend their the RRAC committee meeting once a month. I will tell you I'm going to miss it, but I know I have to turn over those reins to someone else at this point. They meet once, I almost said we because I'm still on it. We meet once a month. We meet on the first Thursday of the month. And right now, while we are virtual, we meet starting at 4 o'clock. It tends to run about an hour, hour and a half tops. Usually during the, and so that would be November 3rd would be the first meeting. If you volunteer to be on the Recipient Rights Advisory Committee. I will tell you, you cover a lot of turf in that group. They cover everything from site reviews to policies to practices to investigations. John Paul, do you have a question?
No, I was just gonna, I would like to serve on the Recipients' Rights Advisory Committee if I could. I previously served on it for 3 years back in 2009, 10, and 11 when I was previously on the OCHN board, back when it was CMH board. But I've had, oh, can you hear me okay?
Yes.
I think there's some interference, but I would, I'd be interested in serving on it.
Okay. Is there anyone else that was interested? Hearing no one else, John Paul, welcome back to the Recipient Rights Advisory Committee. Okay. And as I said, the next meeting is Thursday the 3rd at 4 o'clock. Okay. The next committee is Citizens Advisory Committee. And Melkaya, are you on the call?
Yes, I'm on the call, Jonathan.
Would you like to stay on the advisory committee, or?
I'd like to step down as board liaison. I still will attend the meetings. It's a requirement of my job, but I'm more than willing to let someone else have that opportunity.
Okay. Is there anyone else that is willing to step up and attend the Citizens Advisory Committee? It doesn't sound like anyone's volunteering. So Melkaya, if you would represent us and be our liaison, that would be awesome.
Okay, thank you.
Thank you. And then the last one is the Oversight Policy Board Committee. And I know this is related to, oversight policy is actually related to the substance use, and they meet quarterly. And I know, Eric, you stepped up and came on board last spring on that committee. Would you like to continue on there?
Yes, I would. Thank you.
You're welcome. Okay. It sounds like we filled the slots. And at this point, I don't think there's anything else to cover on this topic. So back to you, Sarah.
All right, thank you very much. So we are now on other business. Was there someone talking about this? I wasn't certain. I did not know this was on other business. The 21-day racial challenge. Who is?
Hi, this is Sheila. I actually added it because the board expressed interest in starting in November, but obviously with the election and everything, it kind of got postponed. So Trish is seeking to see if November 16th is a good date with the board to start the challenge. So I guess we're just asking for an opinion on the start date.
So that would put us next week, Monday?
That's correct. Yep.
I think that would work. Let me see what we've got in the comments. I saw a comment come through.
I see handy up.
Hands up. I thought it was comments. Hands up. Okay. Judy, then Melkaya.
Thank you, Sarah. We had talked about having 2 ways to address this challenge. One was an online notification, and others was more self-directed. Is that still the way we're going to go, or maybe my question wasn't clear? But initially we had like a daily reminder for a period of time. But at our study session, we talked about also providing board members with the opportunity to do a more self-directed coverage of the challenge. So I just wondered where we were on that.
I see Trisha on. Trisha, would you be able to address that?
Hi, yes, I just put it in the chat. We would be able to put it on Boardable so that people can go as they would like, and all the links would be there, as well do a daily email.
That's great. Thank you.
Thank you. Melkaya?
That kind of addresses my question, because the week of the 16th is a really heavy week for me. I wouldn't be able to do it, but if we can do it at our own pace, then that I don't have any objections. Thank you.
Judy, did you have another question, or was?
Actually, I did, but I want, closure on this particular one before I ask my question, if that's okay.
Okay. Well, it sounds like I'm not hearing any other comments regarding the week of the 16th, that would be a good week. That we would be a good week to start on the 16th. I would say we'll go ahead.
Yeah, this is Steve. I have a question. Do I understand correctly that it's going to be the actual stuff is going to be on Boardable, but we're going to get a daily email to remind us to go to Boardable and do it at our own pace, or what?
That was my understanding, that there would be opportunity to do it on Boardable as a self-directed. And Trisha, if I'm wrong, you can clarify for me, but that was my takeaway.
Yes, you would get the email that you could click right from the email, as well as be able to find the information for all 21 days on board.
All good then, knowing it is a self-directed. You will get reminders on Boardable that we can start this challenge on the week of November 16th, and it will run through December 17th. Not hearing any objections, so I will say that we would start this on the 16th then. Thank you. All right, Judy.
Yeah, thank you, Sarah. At our last board meeting, we discussed the extending of the strategic planning process for a year. And I wasn't clear if we were to approve that or if we just affirmed that we were comfortable with that decision. And I just kind of wondered where we were on that, and if there's anything that requires our approval. Is there someone who could maybe fill us in a little bit more on a timeline today? Or I'm just not sure kind of where we are on that map.
So this is Nicole. Dana, do you want me to go over that, or do you prefer to do that one? Oh, she might be muted. Sarah, Dr. Guadalupe, can I go ahead? I think you're muted. Sorry.
I was saying, yeah, go ahead, Dr. Lawson.
Okay. Sorry.
Thank you.
Yeah, so I apologize for the confusion. We were seeking approval, and I believe it's on the agenda for the full board meeting next week. In terms of the timeline, what we would do is if the board didn't approve of the extension, we would have to start strategic planning right now in order to have something in front of you for review and approval in August and September of 2021. So what we're asking is that the current plan be extended to encompass all of fiscal year 22. And then what we will do is next October, so October of 2021, we would start our strategic planning process and use that entire year to get a new strategic plan to the board for review and approval in August, September of 2022 instead. I hope that's a better timeline, Judy. Did I get it?
I was just wanting to make sure where we might want to be in the approval process and maybe have something that was in front of us, and you probably have that in the works. I don't doubt that. In terms of like increased outreach for input and things of that nature. So the board, we were introduced to it last month. I think we're all familiar enough with what it is that you want to accomplish. I just want to make sure that you were comfortable because it seemed that approval was something you were seeking. I just wanted to make sure that, that we were all aware and had some overall sense of how the extension would play out. That's kind of where I am.
Okay. Yep. I appreciate that. And we definitely want the board's approval so that we know that we can, not engage in all of that this year and start engaging in it in October. So we can add a slide in there for the full board meeting next week, just to make sure we cover all those bases.
Thank you. I know our chair indicated that if there were any objections, they were welcome at that time. There weren't any, so I think we're probably on a good path that way, but maybe just a little bit more detail on how we're going to get there.
Okay, no problem.
Okay, sounds good. Thank you.
Okay, Melkaya?
Yes, I had a question, Nicole. I just wondered if there was any space for board participation in the process this time.
In the strategic planning process?
Yes.
Well, I would assume so. I would completely defer to Dana on that. That wouldn't start taking place until about a year from now.
That's fine. Thank you.
Yeah.
Okay, thank you, Dr. Lawson. Any other business that we need to discuss in the other business? Okay, I am not seeing any, so we will move on to our final opportunity for public comment in today's meeting.
We do not have any public comment this evening, Sarah.
Thank you, Christine. All right, and board member comments. Sheila, if you could just go through the roll, please.
Sure, Mr. Furman.
Yes, I apologize for my limited ability to interact tonight. I was unable to join via my laptop and can't get my camera in front of my face, but I would like to say very much thank you for the presentations tonight and welcome to our new board member. Thank you.
And Ms. Bernard.
I'd like to say welcome, Christina, our new board member, and then also congratulations to everybody on their new positions. I thought this was a nice meeting, brief but good. And I would say that if we're postponing the strategic plan, I think Micaiah was mentioning or asking if the board members would be included. And I think, I don't want to speak for her, but I'm agreeing with her that I think it would be great if the board members would let Nicole or Dana know that I think we would like to be a part of that, or at least I would maybe make a request for that. But anyway, thank you. That's my comment.
Mr. Torres.
I just want to welcome Christina to the OCHN board. Thank you.
Mr. Lindemeyer.
Hi, I just want to, I do want to welcome Christina as a new board member. I'm fairly new too. I started in April. So it's great to have you on board. One thing I would like all of us to think about is what role do we have, if any, with the news that came out today that there is going to be a some relief on the virus as far as the a vaccine. And from my understanding, the public opinion is split on whether or not people would be taking a vaccine. And if we have a role in encouraging people to listen to the medical professionals, I think that it's important that we do that. Otherwise, we're never going to get our lives back in order. Thank you.
Miss Namie Dyer.
Yes, welcome, Christina. I'm also one of the newer members. Started at the same time as Eric back in April. It's good to have you on board. And as always, everybody, please continue to stay safe.
Miss Summers.
Thank you, Sheila. Again, welcome to Christina. And you started on a pretty exciting path, and anything any of us can do to help you along the way, please don't hesitate to let us know. I'm sure you'll be embarking on an orientation soon, but your energy will be very welcome at our board table. So thank you. That's it.
Miss Newman.
Just want to do like everyone else, welcome Christina to the board. It's a very challenging at times, but a very interesting position to hold. So I welcome you, and we had a very brief meeting for which I'm eternally grateful. Thank you. Have a good night.
Dr. Taub.
Hi, I've got a couple of things. First, welcome to Christina Root, our new board member. And I'm sure she'll be going through the onboarding and everything, and it won't look so daunting once you figure out what's going on, which usually to me takes about 6 months. Secondly, what Eric said about the vaccine, I agree. It looks like there's two weeks till approval at least, and then the FDA will approve it and it'll immediately start being shipped, and there should be vaccinations available for people my age and people with underlying conditions and first line responders by the first week in December. That's what I'm hoping for. The Pfizer one that's going to be okay first is a 2-shot deal. I don't know if it's a month apart, they usually are. And then thirdly, on the 21-day racial challenge, I'm planning on doing it. I don't know if I'll agree with everything. I haven't looked at it when it was up before. I didn't have a chance to even get involved. But I think in this whole challenge that we're going to be facing over the next years, we might disagree with each other on methodology. And I think what we have to do is to listen to each other. And even if you disagree with somebody, let them know that you listen to them, and then they'll listen to you, and we'll come up with some solutions, and the future will look different than, because we seem to have made a lot of progress in the 60s and 70s, then we seem to have bogged down. We need to get going again. And everybody stay safe.
Dr. Hans.
Yes, thank you, Sheila. I would also like to welcome Christina. Yes, it seems daunting in the beginning, but this is a very close, friendly group. We sometimes disagree in our opinions, but this is a very fulfilling challenge that we take on ourselves, and I want to thank you for taking this position. About the 21-day challenge, yes, I also did it on hit or miss basis when it first started, and I intend to do it. But I'd like to say, even if we take a challenge, it's very important to have conversations about this issue. And I think we have to be very honest in our conversations, and also be able to explore some of our biases, or where they come from, or what our own personal experience is with. In the last 6 months, I have learned so much about myself, things about myself, the views or biases that I had that I didn't realize I had. It comes out in small ways sometimes, sometimes out of ignorance, and sometimes out of cultural differences. So I will request everyone that while we take this challenge, we should also be open to conversations among ourselves, or anybody who is open for a discussion. Thank you.
Mr. Landsman.
Thank you. First of all, welcome Christina Root to the board. Second, I want to thank the board. Where we're at right now, we're coming into the holidays. People keep reminding me we're coming into the holidays. I said, oh yeah, Veterans Day this week. And they said, no, Thanksgiving, Christmas, New Year's. And so one of the things that I wanted to help everyone think about is we're actually, whereas most every other organization might be spinning down for the holidays, we're actually starting to spin up because we will be focused on doing things like the strategic plan, like looking at our board bylaws and policies, leveraging our study sessions to drill down, to get our hands around some of the topics we're dealing with, like redesigns and other initiatives that are important to our organization, either from a virtual or telehealth operations, or just from an evolutionary perspective. And then as well, we're going to be dealing with in the coming weeks, what will our calendar and schedule be like for the coming year? So I just wanted to let everyone know, first, thank you for being on the board. Thank you for actively participating, whether you've been here for 20 years, I won't even say how much longer than that, whether it's been 20 years or 20 months or 2 months, doesn't matter. You'll be in a position to help influence where we're going. It's not about where we've been, it's about where we're going. So with that, thank you all for stepping into various roles at this time.
Ms. Root.
Thank you so much, everyone, for the warm welcome, and congratulations to the new position appointments, and thank you for the presentations today. I just wanted to say, I have to admit, I was a bit intimidated by all of your amazing and extensive professional backgrounds, but I do already feel so supported and lucky to have this opportunity to work with you to serve our community. So I'm really looking forward to it, and thank you so much again.
Dr. Guadalupe.
Thanks, Sheila. Again, welcome, Christina. We're happy to have you on the board. And I would just thank all the staff for their continued hard work for supporting the individuals that we serve. And with Veterans Day coming up this week, as Jonathan mentioned, thank you to all the veterans and to our staff that work with veterans to help support them in the community. So with that being said, have a great night, everyone. Have a great week. Stay safe, and this meeting is adjourned.
Thank you, Sarah.